Olopatadine HCl drops are used to relieve itching and redness in the eyes caused by allergies. It is not recommended for treating eye irritation from wearing contact lenses. The recommended dosage is 1 to 2 drops in each affected eye twice a day, with about 6 to 8 hours between doses. It is best to use the drops at the same times each day. When using Olopatadine HCl drops, it's important to follow the instructions on the product package or as directed by your doctor. If you have any questions, consult your pharmacist. To apply the eye drops, wash your hands first to avoid contamination. If you wear contact lenses, remove them before using the drops and wait at least 10 minutes before putting them back in. Tilt your head back, look upward, and pull down the lower eyelid to create a pouch. Then, hold the dropper directly over your eye and place 1 drop into the pouch. Close your eyes and apply gentle pressure for 1 to 2 minutes to prevent the medication from draining out. If you use other eye medications, wait at least 5 minutes before applying them after using Olopatadine HCl drops. It's important to use this medication regularly at the same times each day to get the most benefit from it. If your condition does not improve or gets worse, seek medical help right away. Side effects of Olopatadine HCl drops may include headache, blurred vision, burning/stinging/redness/dryness of the eye, eyelid swelling, or a feeling as if something is in your eye. If any of these effects last or get worse, tell your doctor or pharmacist promptly. If your doctor has directed you to use this medication, remember that your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. A very serious allergic reaction to this drug is rare. However, get medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, trouble breathing. This is not a complete list of possible side effects. If you notice other effects not listed, contact your doctor or pharmacist. For medical advice about side effects in the U.S., call your doctor or report side effects to FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, call your doctor or report side effects to Health Canada at 1-866-234-2345. Before using Olopatadine, make sure to inform your doctor or pharmacist about any allergies you may have. This medication may contain inactive ingredients that can cause allergic reactions. It's important to discuss your medical history with your doctor or pharmacist before using this medication. After applying this drug, you may experience temporary blurred vision. It's important to avoid activities that require clear vision, such as driving or operating machinery, until your vision has returned to normal. If you are planning to have surgery, it's important to inform your doctor or dentist about all the medications and herbal products you are using. If you are pregnant, this medication should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor. It's also unclear whether this drug passes into breast milk, so it's important to consult your doctor before breastfeeding. When using Olopatadine HCl drops, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription, non-prescription drugs, and herbal products, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. Be sure to consult with your healthcare provider before making any changes to your medication regimen. If this medication is swallowed, it can be harmful. If someone has taken too much and experiences severe symptoms such as passing out or difficulty breathing, it's important to seek immediate medical help by calling 911. Alternatively, you can contact a poison control center for assistance. In the U.S., you can reach out to your local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center for guidance. Make sure to keep all your regular medical and lab appointments when using Olopatadine HCl drops. This will ensure that your condition is being monitored and managed properly. It is important to follow up with your healthcare provider to ensure that you are getting the most benefit from this medication. If you are using Olopatadine HCl drops on a regular schedule and happen to miss a dose, simply use it as soon as you remember. However, if it's near the time of your next dose, it's best to just skip the missed dose and use your next dose at the regular time. It's important not to double the dose to catch up. When using Olopatadine HCl drops, it's important to follow the storage instructions provided on the product package or by your pharmacist. Keep the medication away from children and pets, and do not dispose of it by flushing it down the toilet or pouring it into a drain unless instructed to do so. When the medication is expired or no longer needed, be sure to properly discard it by consulting your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.